At Grand Rapids Orthopedics, one of the areas of expertise that patients are most satisfied with is arthroscopic shoulder surgery. We have had uniform success with a variety of procedures which are leading to less patient complaints of discomfort and disability in the recovery period, and ultimately excellent outcome. Over the last 10 years, we've seen advances in nearly all areas of shoulder arthroscopic surgery. What used to be at times an irreparable rotator cuff tear can now oftentimes be fixed through arthroscopic techniques. There have been advances in labral treatments, a ring of cartilage which deepens the socket in the shoulder and helps provide stability. Traditionally, treatment was only repair or trimming. There's a new bicep tenodesis procedure which allows us to solve the problems without sacrificing any function. What this means for the patient is a much easier overall process. It's an outpatient procedure, come in, go home the same day. It takes less than an hour, all done through these arthroscopic incisions. There's less discomfort. There's an easier rehabilitation process, whether or not it involves any formal physical therapy, and an expeditious return to the activities that you desire. At Grand Rapids Orthopedics, we use a variety of techniques to assist in the determination of the problem that might be causing your shoulder pain. Imaging is obtained with x-rays. At times we use MRIs as an adjunctive imaging technique, but oftentimes we can obtain information simply from your history or story, our physical examination, and at times a diagnostic injection in an office setting that may obviate the need for an MRI or other more expensive testing. In the past, many of these open shoulder surgeries required a lengthy period of disability and discomfort. Now with arthroscopic procedures, recovery is much more rapid. Recovery involves a simple sling use. In the past, there were large orthotic apparatus that abducted the arm well away from the body. Now a simple sling is generally all that is required. There are procedures for labrums that may allow you to have immediate function, sometimes with a bicep procedure, 3 weeks in a sling, a bank heart labral repair, 4 weeks in a sling, a rotator cuff repair, 6 weeks in a sling, and then progression to activity. It's always pleasing for us to hear patients' positive feedback. Patients are extremely pleased with the lack of dramatic discomfort that they have and their ability to get back to desired activities and work in a more rapid fashion. Shoulder problems can be one of the more painful problems to deal with, and when you're dealing with that pain, having a problem treated and solved is important. At Grand Rapids Orthopedics, we can expedite the process, evaluate you sooner, if necessary, take steps to do a procedure to definitively solve the problem sooner and eliminate a lot of the waiting and discomfort that goes along with this injury. So the next step, if you're having any shoulder concerns, reach out to our office staff. We'd be happy to arrange something in the near future and certainly can get you in to be evaluated sooner than most other locations.